So my name is Bray Chibuke Ekete, and this is my colleague Franklin, who is a medical recruiter. So what we came here to do is a free medical outreach for people that don't have access to care. Our goal is to reach the unreachable. We're trying to bring medical access to our mothers so that they can know their conditions and they can also get a proper treatment. Because from the situation that we are getting from here, many people have not even checked themselves in months. And we are seeing conditions here that are very critical that need for them to go to the hospital. Now, if we don't actually do something like this to help them find out this problem on time before it gets worse. Now, the only time they will be able to go to the hospital is when this case has become a critical one. And by then, it will be very difficult for the hospital to take care of them. So, this is definitely what we came here to ensure that we make the life of our mothers much more better and to preach the gospel of access to care. Because our platform, Medicine Solution, is a place where people can get access to care regardless of where they are. At every single time, we have medical doctors and it's all through their mobile phone. So with my colleague here, who is a medical worker, continue.
Early detection, they say, is the key to a proper diagnosis and treatment. What medicine is trying to solve is the gap between patients and healthcare services. We know that it's very difficult for most of us to go to the hospital. One, because of the long waiting time. Two, most of us are struggling, and it is difficult for you to get your hospital appointment and go back to your day-to-day activities. The normal scenario that we have in Nigeria here is for you to go to the hospital, you have to close your shop, make sure that your business is shut down for a whole day before you will just spend just 5 minutes of consultation with doctor. And this has led a lot of people to self-diagnosis and relying on healthcare information or healthcare services from unverified sources. So Medizi is here to bridge that gap. Medizi is here to change that perspective and that narrative of self-medication in Africa. So with Medizi, you can come to the platform and you will talk to doctor. So with that, any problem that you're having, it can be marked earlier. And we are beyond just talking to a doctor. We are a healthcare access platform. We have so many hospitals, diagnostic centers, pharmacies, all registered and verified, working with us, so that anybody, anywhere around Enugu State can get a proper healthcare services. When you come to our platform, and your case is something that needs to be managed physically, because healthcare is not something that can totally exist online. When once we are done doing your basic triage and you need a proper follow-up, we link you to the nearby verified healthcare facility in your location. We notify them in any emergency situation so that before you come, that facility is prepared to handle your care properly. So we are here to create awareness and to also showcase part of what we want to the Widows Association currently here. So we are here giving them a free medical outreach. With this one, we check their vitals, they get to talk to doctor. Most of them have not been able to talk to a doctor or even check their BP or blood sugar level. And we know all these things are silent killers. They may not show signs until when it is quite too much. By that time you are going to the hospital, it will just be managed. But with early detection, which is what we are preaching, and that is why we are here, early detection, your condition can be managed and properly diagnosed. Thank you.
Widows Association, diocese, medical attention for widows. By the grace of God, all our God. mass. By evening, I make it an evening. I do a mass. And by tomorrow, I need that some Gabia animals. And may lunching. Lunch 9 widows, especially the young ones. And we get on themselves. Then a mother and a reasonable support. I will. I went to
Lord, you are my God. Nothing compares to you. You are greater than the greatest. You're higher than the highest. Incredible, that's who you are. You're
Association. And so now one of the people has sent it for more skills, which is alcohol, and he have one more was stress. It's a papa. And all our Kata. If you are actually one that if you have now, measurement in the you first way is 40, second way is 41, then keep 49. So, and the full rate that I'm going to use is 58, which is 58 plus 2 inches. This is 58 plus 2 inches for turning. And I'm starting from my shoulder. The shoulder is 14. Which is 8 divided by 2 is 8. That's 8 plus 1 inch because of your turning and the sewing. Then I now get my armhole. My armhole is 9, which is here now. Then first waist is 15. Second waist is 19. And the hip is 24. Then, multiplied by 4 is 10. Then 10 plus because it's kaftan. I'm going to use this is another one because kaftan has to be free on you. So I'm going to use this sheet on my board, which is 40, which is 10 plus 6. And at my waist,
Extraordinary strategist.
as my sewing allowance.
Impossibility
My half
specialist.
second waist is 41. That's 41 plus 2 inches
Made
as
the
well.
arch your
Then
footstool.
hip is 49.
Incredible
49 plus
God.
2 inches. Then it's going to have a kind of a line. It's not going to be a as a straight cut. That's why I use 20 instead of because if I want it to be a straight cut, I'm going to use my hip but I didn't want it. I wanted it to be free.
You're seated in heaven.
For me to get my airline.
Kan na wake it up. BK oil.
Okay.
No, we need BK oil. Palm kernel oil.
Incredible